Welcome to the latest episode of the Forecast in 5. I'm your host, Seth Katz. Joining us today is Johnese Spisso. Johnese assumed the position of President of UCLA Health, CEO of UCLA Hospital System, and Associate Vice Chancellor of UCLA Health Sciences in 2016. Johnese is a nationally recognized academic healthcare leader with more than 30 years of experience and oversees all operations of UCLA's hospitals and clinics, as well as the health system's regional outreach strategy. Before coming to UCLA, Johnese served in a number of senior leadership roles at UW-Medicine in Seattle, UC Davis Medical Center, and started her career as a registered nurse at the University of Pittsburgh Medical Center Presbyterian. Welcome, Johnese. Appreciate you
Thank
being with
you.
us today.
Thank you. I'm glad to be here.
Excellent. Well, let's get started with some questions. For 35 consecutive years, UCLA Health hospitals have appeared on U.S. News and World Report's National Honor Roll, a distinction that only 20 hospitals or systems providing the highest quality of care across multiple medical specialties receive. Also, most recently in 2024, UCLA Health was ranked number 1 in both California and in LA. Can you share with our viewers what makes UCLA Health distinctive and has enabled the system to earn this prestigious recognition?
Well, thank you, Seth. And together, the UCLA Hospital and Clinic System and the David Geffen School of Medicine at UCLA really strive every day to be leaders in setting the standard of excellence for patient care. We really are able to excel because of our comprehensive academic medical system that's really world-renowned for patient care, research and discovery breakthroughs, and a commitment to innovation and community engagement. So we offer really a breadth of services through our 5 hospitals and our network of over 280 primary and specialty care clinics throughout Los Angeles and Southern California. We provide care for over 800,000 unique patients in our system, and we see almost 4 million outpatient visits a year and about 42,000 inpatient hospitalizations. But I think what we're best known for, what our patients tell us, is the care and compassion that is delivered to them when they enter in our system. People expect the best care at UCLA. They know we have some of the best expert team members in the world, but it's the way our staff treat them with empathy, kindness, and compassion that I think really makes a difference in their well-being and their outcomes.
Absolutely. UCLA Health's growth under your leadership has been remarkable. In addition to the system's 5 hospitals in Greater LA, you operate close to 300 clinics that offer primary and specialty care services throughout Southern California and along the Central Coast. Why are these clinics so essential as UCLA Health continues to expand its footprint across the region?
Well, it's so important because here we are in Los Angeles with 10 million people to serve. And we know we can't expect everyone to come to Westwood, Santa Monica, or now the Central Valley to our hospital-based clinics for care. So we really try to say, let's really move into the region and try to have a clinic within 30 minutes of where everyone lives. So we've been doing that growth over the past decade. Each year we open about 8 new clinics. When we open a clinic, the great news is we're full in a few months. There's that brand draw of the UCLA Health brand. But our goal is to really keep care as close to where people live as possible. And in addition to that primary care, we've added a lot of complex specialty care. We have radiology and imaging centers. We have ambulatory surgery centers. We have 11 immediate care walk-in centers for urgent care type visits that help people get efficient care there when they don't need an emergency room. And so we're going to continue that strategy. We're as far as San Luis Obispo, Santa Barbara, the coast. So it's really been a great strategy and allowed us to serve many more patients.
Glad to hear about that growth. The David Geffen College of Medicine is located right here in Westwood, next to Ronald Reagan UCLA Medical Center. Having a top-ranked medical school that trains physicians and scientists such a short walk away from a level 1 trauma center that is renowned for its award-winning care presents a tremendous advantage for students, patients, and so many others. Can you touch on this connection and why it's so important?
Absolutely. It's really been the secret of our success to really be based on a campus with a fantastic School of Medicine, School of Nursing, School of Public Health, School of Business, that we get to really work with on all of our areas of innovation. The David Geffen School of Medicine does almost $1 billion a year of funded research. And that allows us to really be doing the latest and greatest discovery on better cures, better treatments for patients. We run clinical trials. And for us working here, it's so really invigorating to see how research is transforming care. In the past decade alone, over 14 cancer care drugs were developed by our teams at UCLA. The very famous breast cancer drug Herceptin was developed by Dennis Slayman. Over 3 million women have had that drug, right, throughout some time in their life. And it's just amazing to see connecting the dots between research and changes in medicine. And we're very fortunate to get to see that play out on a daily basis here.
Remarkable to hear about that innovation that's taking
Yeah.
place right here on campus. Since we have many Anderson MBAs watching who are focused on advancing into leadership roles, especially across the healthcare industry, your career progression starting as a registered nurse to ultimately becoming the chief executive of one of the most comprehensive health systems in the world is extremely impressive. Would you be able to provide some pointers for those aspiring to become CEOs who are listening?
Yes, I get asked that question often. And, I'll say throughout my career, and I've been in healthcare now for over 35 years, I had the opportunity, starting as a bedside nurse, of really working at every rung of the ladder, right? Advancing from nurse leadership jobs to hospital leadership jobs to health system leadership jobs. And what I would say is I've always had the opportunity to work in organizations that really surrounded me with great mentors to learn from, particularly early in my career. And also organizations where there was an opportunity if you demonstrated that you had the potential for growth to be there. So it's one of the things that I love about UCLA as a teaching organization. We're able to help people create career paths so they stay with us for their career. We're doing a lot of innovation things, even with entry level positions. One of the great things we started about 4 years ago with the UCLA extension is we wanted to allow some of our employees in environmental services, food and nutrition to get into healthcare where they could have steady, great paying jobs working for us. So we worked with the extension, wrote a curriculum for a medical assistant training program. And we have a booming program where people can work their day job, go to school 3 hours at night at the extension program, and in 1 year, get their certificate to be a medical assistant and have great jobs in our clinics. And we provide scholarships to do that. So it is, organizations like UCLA and others. I think when people are choosing careers, choose the organizations that are really willing to invest in you as an employee.
Very helpful. If we look ahead at healthcare over the next decade, the industry will continue to evolve, and this is going to be largely driven by technology advancements. AI and data are two aspects that will play a critical role. Can you share your perspective on how you believe these areas will shape the healthcare industry in the future?
Absolutely. And I'm so excited about the opportunities that we have with AI on really helping us transform care to make it more efficient, better, and safer for our patients. We're already using a lot of tools in AI in some of our business practices so that we're able to do things more efficiently and accurately. And then on the quality side, when you look at the new tools that are coming that help our physicians and healthcare professionals identify high risk areas. Some of the algorithms that we're running in our division of computational medicine and others really look at these models and say, how do we predict which patients are at risk for complications? How do we know which patients need extra safety measures? I think it's really exciting. I know there's a lot of fear out there about AI. Is it going to eliminate jobs? Are we all going to be out of business? I think AI will be a tool that allows us to care for more patients more effectively, safely, and better. And I think it will also enhance the experience of our healthcare professionals. We're already seeing that with some of the tools we're using now with ambient listening that help the physicians transcribe a note very quickly, very efficiently, instead of writing everything out as they're trying to interview a patient. They have the note prepared at the end of the visit and can just validate it. So I'm really excited about these opportunities.
Completely agree. Exciting to see what lies ahead. And that brings us to the end of today's episode. Thanks so much for taking time out of your busy schedule to be with us, Johnese.
Thank you. Always a pleasure.
And thanks to all our viewers for tuning in. We'll see you on the next episode of the Forecast in 5.